Lincoln Mayor Leirion Gaylor Baird turned Nebraska's capital city into a ground zero for destructive COVID tyranny. From the moment the manufactured crisis hit in 2020, Baird suspended Lincoln's city charter, declared a local emergency, and seized sweeping powers that crushed small businesses, isolated families, and harmed children for years. Her decisions prioritized control, federal funding, and elite agendas over the well-being of residents, leaving lasting economic and psychological damage across the community. In March 2020, Baird activated the Emergency Operations Center and shut down non-essential businesses while limiting gatherings to just 10 people. She funneled millions in CARES Act money to hand-picked non-profits while hospitals reserved beds for a threat that never overwhelmed capacity. Early deaths involved people with severe pre-existing conditions. Yet Baird used every case to justify more restrictions and ramp up flawed PCR testing that produced false positives by the thousands. Lincoln followed scripted federal directives instead of protecting local freedom and common sense. By July 2020, Baird imposed Nebraska's first municipal mask mandate indoors, extending it for nearly a year despite clear evidence of harm to children. Schools and youth faced muzzling that caused developmental delays, anxiety, and cognitive issues. In November, she banned organized sports for kids under 18, sidelining over 10,000 Lincoln children and teens at a critical time in their lives. These policies triggered spikes in youth suicide attempts, increased family stress, and hid child abuse cases because schools, the main reporting system, were disrupted. Baird's own daughter received special treatment in a tennis controversy, while families endured the full weight of her rules. Baird aggressively promoted the vaccine rollout starting December 2020, turning Lincoln into a distribution hub with mass registration drives and color-coded risk systems. She celebrated high vaccination rates and eventual green status while ignoring adverse events, breakthrough cases, and excess mortality that followed the shots. Mental health grants she distributed did nothing to stop the 20% statewide rise in alcohol, drug, and suicide deaths driven by the isolation she enforced. Small businesses closed permanently under her mandates while large interests and connected non-profits received federal cash. Baird's hypocrisy stood out clearly. She preached sacrifice and compliance in weekly briefings yet exempted herself and her family from the same standards. Her administration manipulated hospitalization numbers and death counts to maintain fear and justify continued control. The failed recall effort showed public anger, but Baird survived and later bragged about Lincoln's outcomes while ignoring the human cost. Fractured families, lost businesses, traumatized youth, and eroded trust in local government. Mayor Leirion Gaylor Baird's COVID response represents classic elite overreach that prioritized power and narrative over people. Lincoln residents paid the price through unnecessary suffering that continues today. Her tenure serves as a warning about progressive mayors who weaponize emergencies against their own citizens. Nebraska must remember these failures to prevent similar damage in future crises.